Welcome everybody. If you clicked here, obviously I assume that you have some heartburn problems and maybe it's a mystery for you and you'd like to get a handle on that. And it would be my pleasure to share with you some of the frustrations, some of the insights that I've learned over the years by working with my patients. So welcome here to this quick webinar. My name is Kasia Kynes. I'm a functional nutritionist. I am a clinical nutritionist that specializes in gastrointestinal issues, especially complex cases. So I've worked with a lot of patients over the years that have a lot of gut issues. I'll keep it very simple. I'll try to keep the science to the minimum and explain things in lay terms so it's very, very easy to follow. So, starting with heartburn. What if I told you that your consistent, persistent heartburn that doesn't respond to antacid medications is not just a heartburn at all? What if it's a hiatal hernia? And I wonder if you've heard of it. So what happens if you have heartburn constantly? What happens if you're not relieved? Basically, a doctor will prescribe a medication and leave it at that. But what is actually happening? What is the root cause of this? Can we amend it? Can we get a handle on it? Can we get rid of it? And many of the answers are yes, we can. The heartburn is a big problem in our culture. 60% of our population will experience reflux, acid reflux, excuse me, gastroesophageal reflux, GERD, within 12 months, and 20 to 30% of us on a weekly basis. And if you look at statistics, as of 2010, Nexium was the second best-selling medication in the whole country, and Prilosec was the sixth most prescribed medication. So, of course, it's a big issue. It drives the industry, and I have to tell you, I hate seeing advertisements on television direct to consumers pushing for the little purple pills, and it seems like it's a great solution without any side effects, and it's simply not true. A simple explanation of heartburn. We have two pictures here. On the left is a healthy stomach, and on the right is a stomach which may produce a heartburn. Not hiatal hernia, just a heartburn. When your food enters the esophagus, which is right here on the left, it passes through lower esophageal sphincter, the two blue arrows. And when it enters the stomach, the signal is to close the sphincter. It's just a muscle. It's a very beautiful, tiny little muscle. It keeps the stomach contained and closed because the acid, the gastric acid that is going to be secreted by the lining of the stomach, needs to work on the meal that you just had, but it should never enter esophagus. You see, the stomach is very smart. The stomach produces a mucosa and then produces the stomach acid. And this way, stomach is protected and it's not being digested by the acid. But when your acid mixed with your food backs up into the esophagus, unfortunately, esophagus doesn't produce that mucosa because the stomach acid is not designed to be there. So you're running risk of Barrett's esophagus, erosion, inflammation. That's not good because that could develop into a precursor to cancer of the esophagus. So of course, whenever you have a heartburn, your doctor will be inclined to just give you acid blockers just to protect the esophagus, which is understandable. On your left, you see that the esophageal sphincter is relaxed and opened. You see the little passage? That should not happen when you have the meal being churned together with stomach acid because, think about it, your stomach my stomach at least, is the size of a fist. I'm looking at my fist, maybe a little bit bigger. It does stretch because it's a muscle, so it has stretch receptors. Oh, you fill it with a meal. So think about the meal on your plate. All that meal will fit in your stomach, which is pretty incredible. Sometimes that meal may be really too large, especially if we go to buffet, and especially in view of American sizes in the restaurants, right? They're not really one meal, there's 2 or 3 meals sometimes. So if you have that pressure in a small space, somewhere where there's a leeway to move, to stretch, that pressure may actually open that esophageal sphincter too much. And that's the combination of gastric acid and meal together, seeping through and backing up. That's just physiology. That's what's going to happen. But hiatal hernia is a little bit different, and it's confusing, and most people don't know about it just because it produces heartburn. So we assume it's just heartburn. Most of the hiatal hernia cases are called sliding hiatal hernia. You see here, let me point to the picture on the left. You see the white line here. This is your diaphragm. Think about it like as a breathing box. This is where you breathe when you inhale air. This is where it goes. And on the left, the brown corner here is liver. And the stomach is actually right here. The picture is not actually very good. What happens is there's a small opening here in the diaphragm. That is a hole, hiatus, for your esophagus to actually go through, and it meets the stomach underneath. In this picture, when you have hiatal hernia, the stomach actually slides upwards. This is still the stomach. This is the top of the stomach protruding here, like one balloon squeezing, through. And so the esophageal sphincter is now high up there, and the esophagus is up there. So the top of the stomach is still making the stomach acid, and so there's going to be a lot more pressure here from the bulging into that sphincter to open. And so that's why you experience heartburn when you have hiatal hernia. The sliding hiatal hernia, as the name implies, it's easy to slide back. So that's the blessing. I'm going to teach you what to do about it. The more rare type of hiatal hernia, when you have a stomach piece next to the esophagus, that's a paraesophageal hernia, and that may require surgery. In most of the cases, doctors may not suggest surgery. It's just, they just maintain this with acid blocking medications. But we can go much further than this, and that's the purpose of my presentation. Now, how common is a hiatal hernia? It's a common problem, especially as we age, especially when we hit 50 and towards 60 years of age. Approximately 60% of population by the age of 60 will develop hiatal hernia. Now, Dr. Gitelman, one of the most seasoned nutritionists who happens to develop hiatal hernia with symptoms after an accident, after a fall, she claims that up to 94% of hiatal hernia actually may, 94% of heartburn, especially that doesn't respond to the PPIs, may actually be hiatal hernia and not heartburn. So that's a pretty high number. I want to share with you some of the complications of, how would you suspect that you have hiatal hernia as opposed to simple acid reflux. So for me, the first red flag is that they don't respond to acid blocking medications. And then another thing that we see is a dragging, dry, tickling cough without any mucus or phlegm being produced. Some symptoms will be typical of gastrointestinal problems in general, so they're hard to pinpoint, like abdominal pain, nausea, vomiting, easy satiety, dysphagia, flatulence. Now, if you have overall constipation, it means you're straining. And if you strain, you can put pressure on the stomach, and that can bulge and create hiatal hernia as well, so that's a red flag. And then we're going into more of the emotional compartment, which will make sense at the very end of this presentation more. You may feel that your cognition deteriorates, that you have mental fog or dullness. You may have a lot of anxiety, actually. You can become very emotional. And then another thing is that people experience a lot of rapid heartbeat, increased blood pressure out of the blue rapidly, and also chest pain and lung pain and left shoulder pain, problems breathing. Sometimes it's hard to breathe for people. And you might think that it's a heart attack. Of course, check it out. Don't assume it's hiatal hernia. But as you can see, it can be pretty confusing figuring out what it is. if you just have some heartburn symptoms and any of the ones on the list. My advice is to get tested. Because I work a lot with gastrointestinal problems, a lot of my patients have seen many gastroenterologists before finding me. So I always insist that they send me a copy of their endoscopy. And sure enough, sometimes the doctor may ignore a hiatal hernia because in the endoscopy it looks like it's very small, inconsequential. However, it may not be so for the patient. So I have had cases when I had to break the news to the patients, and they had actually no idea that endoscopy showed that. My favorite way to help patients assess if they have hiatal hernia is simple visceral manipulation. And what is that? This is palpation with the hands, with the fingers. These are clinicians that are very well trained in it. It's a specific, very thorough training. Chiropractors, PTs, or some massage therapists may be very well skilled in that. So you have to ask around. And they can literally identify it, tell you how big it is. And the blessing is it's not invasive, it's simple, it's not expensive. And the best part is they can identify it, and guess what? They can, as we say, pop it right back in. So remember, most of the hiatal hernia will probably be the sliding type. So if that's what it is, we can slide it back in. And eventually, if you work with a clinician like that, they might be able to teach you how to assess where it is and how to use your breath and your own hands to push it back in. And then I'm going to teach you more how to maintain that. The standard of care for hiatal hernia, if your doctor does find it, is acid blockers, of course, because the number one priority is to protect the esophagus. Esophagus has absolutely no protection from heartburn from acid, and that's understandable. And I just want to educate you a little bit on the risk of the medication because it was designed for 12 weeks. It's never been designed for long-term application. And so we have some great tools for hiatal hernia that you can maintain long-term that are much safer. And so that's exactly the purpose of my presentation. Just like in the picture here, you see pneumonia. Women, there was a study on the application of PPIs long-term, and just 30 days on it may increase risk of community-acquired pneumonia. But there's other pathogenic infections that may happen. Basically, you're an open door for infections because hydrochloric acid is the first shield that we have that basically on contact with pathogens, it kills them. That's just what it does. Coming into contact with protein, it basically digests them, whether it's salmonella, malaria, or your chicken. Protein is a protein and it's going to dismantle it. So you run risk of SIBO, other infections, colitis, deconjugation of bile acids further in the gastrointestinal tract, and even dislocation of the oral microbiome. So there's a lot of potential long-term side effects. But the biggest effect, I think, on blocking stomach acid long-term is the key vitamins and minerals. Minerals like calcium, magnesium, zinc. You're looking at the hip joint, so you're thinking calcium, which is right, you're right. But I'm also thinking about magnesium, which is also important for the bone. I'm thinking about B12, which is your neurological function, zinc, which is your immunity, iron, which is your energy, oxygenation to the cells, and on and on. There may be more nutrients that are involved. A study of women of 50 years old or older on just 1 year on PPIs revealed that they increased the risk of hip fracture by 40%. And the longer you stay on them, the risk increased to phenomenally high levels. Osteoporosis may be induced by long-term PPIs, B12 deficiency, iron anemia. So I'm not saying it lightly. I mean, sometimes medications are important when they're important, and long-term versus short-term is a big difference. So in case of hiatal hernia, we actually have the root cause and we have solutions. So in cases of emergency, yes, medications may still help, but you will be so well on your way using some of the techniques that I'm going to share with you. What causes hiatal hernia? So if you see how it slides, you can appreciate that any pressure that you put on lower esophageal sphincter, that little muscle between the stomach and the esophagus, that can push it and it can slide, and the stomach will slide. Any trauma can cause it, like abdominal surgeries, jumping, riding on a horse, abdominal exercise like push-ups, a blow to the abdomen as in a fight, or a belly flop dive, falling from a height, exertion of breath while breath holding, any fall for that matter, and especially trauma to the head. Some people may have hiatal hernia that is small and it is inconsequential, it may not produce any symptoms, and just a trauma like that can actually activate it and worsen it. Another area of concern is any physical pressure from extra weight, extra fat, pregnancy, obesity, lesion in the abdominal area taking the space, weightlifting, and of course I already talked about constipation and straining at stool. You can appreciate if you strain, you can feel that pressure around the stomach area, of course. We also eat too much fat, and that irritates the sphincter. Sometimes sphincter malfunctions, especially when we're under stress. It might become erratic and open at the wrong times. We have meals that are too large and they're pushing on the stomach and pushing on that sphincter, just like I explained before. And please don't eat at the coffee table when you have to bend and then you still have tight pants on you or a belt, because you're literally pushing everything upwards. You're inducing the hiatal hernia. Our posture is quite bad. We work on the computer a lot, including myself. We hunch over, we text on the phone. There is something even called forward head syndrome in older people. I chart electronically. I work with patients from all over the country. We have video conferencing, so I'm on my computer all the time. But if you see my home office, I have a stool, and the stool forces me to have a posture that is more straight. So check with yourself. I'm straightening up as I speak. Check with yourself and just maintain that posture. So here are some of the cool things that you can do to help support your hiatal hernia, keep it in check. First of all, let's look at the immediate diet and lifestyle. There are things that relax your sphincter. So instead of being tight closed, when the food is in the stomach, it will open up. Just like we relax too much when we drink alcohol, alcohol, sure enough, is on the list. It will open it up. So you don't want to drink alcohol with meals if you have the hernia. Other foods are onions, coffee, chocolate, sugar, and any type of mint. So peppermint, spearmint mint, mint tea, spearmint tea, peppermint tea, not advised after a meal if you have hiatal hernia, because your esophageal sphincter will say, let me open. Any meal high in fat will be problematic as well. And if that's a problem, I would add ox bile or lipase digestive enzymes just to help the body break down the meals that have fat. And if you've struggled with a heartburn, at least, you know the irritating foods like tomato-related foods or citrus fruits or spices. Yes, they will irritate the esophagus, and if you have hiatal hernia, it's going to make it worse. So my advice is also, and you've also probably heard it, to eat smaller meals. Eat at least 3 hours before sleep and not later, and elevate your head if you're asleep. I would also advise to sleep on the left, not on the right, because on the left, your stomach contents and the bottom of the stomach is towards the bottom. It's below the esophagus, so the pressure of the gravity moves everything towards the bottom of the stomach. If you flip on the right side, you can get an instant heartburn just because the esophagus is below the stomach. And so the content of the stomach will be moving, will be pushing the esophageal sphincter to open, which you don't want. Last but not least, if you are straining because you're constipated, Constipation may be caused by many different things, and I see that clinically, but sometimes it's just lack of fiber or water. And so please, in that case, increase both. Because if you have a lot of fiber, but there's not enough water, you'll be constipated. If you drink a lot of water, but there's not enough fiber, you'll be constipated. Fiber waits for water in the colon. They come together, they bulk up together, a little bit like water coming in contact with dry oats. See, they will expand, right? That's what fiber does with water. It really requires water to expand, create the bulk, so you don't have to strain, you have a nice bowel movement. So that's very important, because as soon as you strain, you might slide that hiatal hernia back up. Now we're moving away from the diet more into the body posture. Just like I mentioned, avoid bending, stooping, abdominal exercises, tight belts. Don't put pressure on that area. Exercise deep breathing rather than shallow chest breathing. So use a diaphragm. And an exercise to check how bad you are out of habit, because we are stressed out a lot of the time. Put one hand above your chest and the other above your belly button. Take a couple of breaths and notice which of your hands is actually moving with your breath. So you want to work on training yourself once in a while to let your belly button hand move more than your chest hand. Another exercise you can do is pant like a dog for 1 minute to also exercise your muscles and retrain how you breathe. I'm not going to demonstrate it, please, of course. I mentioned my favorite area of support, which is visceral manipulation, just because the clinician can tuck it in anytime. If you're stranded, if you cannot cope with it, if it's pushed up again and again, you have somewhere to go, and so you can manage it. So that's very important to know. It's very important for you to find somebody local. But in the meantime, of course, you're working on the lifestyle, being aware of your posture and body mechanics, the meals, and there it comes, the overweight. The overweight, the pregnancy, if you're obese, overweight, when you lose some weight, it's going to really take the pressure off, and you're going to have less problem with a hiatal hernia. And also, a few people actually know and appreciate that medications can weaken your esophagus. So I want you to think about the esophagus as a muscle. So a muscle is only so strong. It kind of, if it becomes too weak, it might start folding. It might start being very flimsy. And with that, some people may feel like can't breathe or can't swallow. And I actually had a patient with a couple of medications for high blood pressure, which depleted magnesium, and it was not supervised correctly, so she should not have been put on more of those. And altogether with a diet low in magnesium, this really caused the esophagus to lose the tone, and she ended up in the ER thinking that she had a heart attack. And of course, they couldn't figure out what it was until she did her research, and in future, anytime she felt the muscle was getting weaker, she would provide some magnesium and she would feel fine. So it gets complicated, and that's not something that we talk about too much, even with our doctors or with our patients. Here's a couple of the medications, so if you are on them, you want to be aware of it and maybe discuss that with your doctor. Intestinal antispasmodics, calcium channel blocking medications, like for high blood pressure, which I just mentioned, and some antidepressants. I have 2 treats for you. So number 1, we talked about foods, lifestyle, weight, pressure. Number 2, body mechanics and posture. Number 3, having a clinician when you can go back and get that addressed right away if you have problems. So now let's talk about something that you can do every day, and if you have hiatal hernia, you should do every day in the morning, first thing, before you drink or eat anything. You're gonna start jumping. You have two options. If you have stairs in your house, you're gonna use those. If you don't have stairs in your house, please go to a sports store and buy a $35 rebounder, because you're gonna jump on that. We're going to work with gravity. It's free. It's within your control. It's empowering. You can manage it. You can do it every day and really slide that hiatal hernia every single morning if it pops up. Isn't that wonderful? That's the coolest thing I ever learned. So first, you're going to warm and relax your stomach. You will drink 2 cups of lukewarm water. Now, when that's set, you're going to stand on the stairs and start jumping. You jump 6 times at least. Every time you jump, you exhale and you land flat on your feet so you can feel them. You create that impact when the stomach with all the content of the water will be pulled down with the gravity, pulling all the content, and hopefully the top of the stomach sliding from the hiatus, from the hole, to the normal position underneath the diaphragm. Of course, use it at your discretion. If you cannot jump, you cannot. If you're too heavy, if it's complicated, you want to play it safe. But that's a very cool and simple tool that everybody can do. And the last treat I have for you is something that is a very hot topic in kind of functional gastroenterology and functional neurology. You probably have heard of the impact that brain injury has on football players. There's a movie about it called Concoction, I think, that is out. There is a very important vagal nerve that runs from your brain through all your intestinal tract all the way to your genitals. It's a huge, it's a wanderer nerve. That's what it's called because it's all over. And if it's impacted in any way, and especially if you have impact by falling off of a horse or being kicked by a horse or falling on your head, there's neurologists and different doctors that are now working with patients trying to regenerate the innervation, the proper innervation of that vagus nerve. How does that apply to hiatal hernia, you might ask? It's a very good question. I actually work with a lot of SIBO patients with chronic SIBO recurrence and complications, and we always dig deeper in the patient's history just to see if there's any injury, and sure enough, sometimes we find them. It can be profound because you can even lose motility in your colon or motility in your stomach if it's really impaired, and it means constipation, it means pain, and a lot of complications. So imagine, you see, this is color coded for interior and posterior innervation. This is all vagus nerve coming through from the brain, coming through the esophagus. It's actually coming through the esophagus as well, as you see. So if you have top of the stomach protruding above the diaphragm, it's kind of bunched together, it's very tight, there's a lot of pressure, so you're actually kind of twisting and pinching that vagal nerve as well, or vagus nerve, sorry. I hope it makes sense. So this is a cool thing. I don't know how much it can help you, but I'm suspecting that working on that regeneration and exercising that part of the vagus nerve might actually make you feel better, less anxious, improve the emotional state as well. So some people, when they have injury to the brain or when the vagus nerve is impacted, lose the gagging reflex. So check with you if you still have it or not. There's different ways of doing it. I won't discuss that, but just check that out. But if you lost it, you can exercise it by gurgling water 3 times a day, maybe 1 cup of water, warm water a day. Gurgle it aloud. And also, one of the other recommendations is singing at the top of your chest, getting the vocal cords to work, getting the muscles to work. Perhaps in the shower so nobody can hear you. That's where I would do it. So here's the bottom line. If you have recurring heartburn, of course, you probably looked at different foods. Yes, there's certain foods that you should avoid, whether it's heartburn or hiatal hernia. If it's just a heartburn, it's your lifestyle, it's the foods, it's too much of it at the wrong time. Just paying attention to that and losing some weight will help. If it's hiatal hernia, or if you don't know, You can do visceral manipulation. If you need endoscopy, that's fine, you know, that's more invasive. Maybe you can do it when you have other GI problems as well. But other than that, find somebody who can provide diagnosis through visceral manipulation, see if they can find it, and then you're going to know what to do from there. You want that treatment, you want to slide it back in, you also want to learn how to slide it, and you want to know what not to eat to prevent from getting it worse. You want those exercises, just like you stretch or go to the gym. You want to jump on those stairs every day 6 times with the warm water to keep it in check. I wish you all the best. I hope this helps. I hope it will give you some relief and will fix your problem, getting to the root of it. Thanks so very much for listening. There is a script below as well. And these are the references. Thanks.